I'm Emma Salisbury. I was diagnosed with lupus at the age of 15. I am currently 21. I started dancing at the age of 7, and by 15, I was already almost a professional. I went to Canada's National Ballet School at the age of 13, and that was my passion. I knew I was going to be a dancer. I had very strange rashes and feelings in my rib cage that caused difficulties to breathe, which a lot of doctors just ended up thinking were issues that was caused by my dancing because they thought it was muscle fatigue. And so when I was at ballet school, they decided to put me through a physio, and they told me I was breathing wrong until I came home. That's when my mom said, we need to do blood work, like something is wrong. And the minute she saw my results, as she's a nurse, she knew that I had to be referred to a doctor right away. When I saw the pediatrician for the first time, they told me that I had either cancer or I had lupus. Little did I know that I had probably the worst case of lupus you could ever have, and that was going to change the course of the rest of my life. I was diagnosed by that pediatrician. My rashes were so terrible and my muscle pain was so intense that I still pushed through and went to dance classes, but it was hitting a point that I was slowly dying. They decided to admit me to BC Children's Hospital for a week to do chemotherapy and prednisone pulses in hopes that my body was going to react well. I basically spent an entire week trying to figure out and get my lupus under control, and for them to figure out what was happening and if they were going to be able to save my kidneys. There was contemplation at a time of possible kidney transplant. And it was kind of entertaining because I have 3 younger siblings. And so they were like, oh, who's going to be the one that's going to have to give Emma a kidney? Luckily enough, because I was in major kidney failure, the chemotherapy and prednisone pulses worked really well over that first week. And they did discharge me after a biopsy. But that's when they didn't realize that I had this special blood clotting syndrome. And within that 24 hours, that blood clot traveled from my back to my brain and caused a stroke the next morning. So I was unable to use the entire left side of my body. And from there, I was then stuck in ICU for probably about 2 weeks, where I was on tubes and I did dialysis. My siblings weren't allowed to come visit me because I was in a state that it would be traumatizing for them to have seen me. I was still having issues with my kidneys, and so my lupus wasn't under control yet. At the same time, I had a stroke, and I wasn't your stereotypical renal patient who was able to walk around and function on their own. It was hard for the renal unit to understand how to help take care of me because they're used to more able-bodied patients, and they were needing to figure out how to combat the blood issues that were happening, since my blood clots 10 times faster than any normal person's would. And so I was on a continuous blood transfusion that was trying to thin my blood out so that I wouldn't have a stroke again. And that meant that every 4 hours I had to get my blood tested. Once my lupus was under control and my blood was at a decent level with the medication that they were trying to wean me on, they transferred me to the rehab hospital. I was that 15-year-old that was like, no, if I want to walk again, if I want to dance again, I am going to dance again, and I am going to walk again. And I had all my little kids that I used to teach actually come in and visit me. And when you have a 3 or 4-year-old telling you that they want to see you back on stage, it's so heartwarming that you feel you have to. Once I was done my time at the rehab hospital, they didn't feel my immune system was strong enough to go right back into the high school climate right away, that we decided it was the best idea to continue doing homeschooling. I did about a year of that, and then I transitioned back into the high school environment. I asked one of my closest dance teachers if she would do one-on-one classes with me. I was able to actually perform in the year-end show, which was the most rewarding experience ever. I had all those little kids who were 3 and 4 when I taught them, were then now about 8 years old, and they were able to stand there and be cheering me on, and everybody in the audience just stood up, and it was the most amazing feeling ever. 2019, I moved to Nanaimo, and I'm at Vancouver Island University doing my BA in Child and Youth Care. I'm working in a specialized school for children with autism. I'm able to sit there with the kids and tell them that I've been through similar things. Like, I've been through speech therapy, I've been through occupational therapy. And so they get to take the time to connect with somebody who knows the struggles. Be a good advocate for yourself. Speak up for yourself. Speaking up and advocating is truly important. It's going to help you succeed through your diagnosis and succeed into getting better.